like a lion, out like a lamb. Yep, we are in the month of March and we're getting ready to wrap up that first quarter, so hopefully you're starting to get in the habits of solidifying your New Year's resolutions, you're building that excitement for spring break, and there's just a lot that happens in March. And March is also Sleep Apnea Awareness Month. Yes, there's a month for everything, but what it does is it allows us to highlight certain things that may kind of slip under the radar. And sleep apnea is a common and serious breathing disorder. It happens when your regular breathing is interrupted during your sleep. And people with sleep apnea have periods where they stop breathing, and that decreases their oxygen levels during their sleep. Snoring is very common with patients with sleep apnea, but not all snorers have sleep apnea, so that can be one sign or one symptom. With sleep apnea, there are two types. There's obstructive, which is the most common form, and the one that we're going to focus on today. And then there's central sleep apnea. Now, the obstructive sleep apnea, it occurs when you have airway resistance. So when air is impeded or blocked from entering your body. It can affect anyone at any age, so infants to the elderly, and it can affect you at any stage through your life. Men are more likely than women to develop this, and some other risk factors include being over the age of 40, a larger neck size or circumference, overweight or obese, having large tonsils, a large tongue, or a small jaw, small mouth. Also a family history of sleep apnea or nasal obstruction due to a deviated septum, large nasal turbinates, allergies, or chronic sinus issues. If sleep apnea is left untreated, it can also result in other health problems. If we think about it, if you're experiencing lack of oxygen through the night, your body goes under stress. That stress then can lead to high blood pressure, stroke, heart conditions like heart failure, heart attack, irregular heartbeat, problems with managing diabetes, depression, or worsening of ADHD symptoms, just to name a few of them. Going back to the ADHD and worsening those symptoms, we have found that sometimes if we correct that, if it's an airway issue and we correct it, we can improve those symptoms of ADHD, which is pretty cool with our children. So if you are concerned about yourself, a family member, whether it's a spouse or a child or a friend having sleep apnea, talk with your dentist or your family doctor. Usually the first step is going through a sleep study so we can accurately diagnose your problem, and then from there we can decide on treatment. The gold standard is still a CPAP machine, but there are other options like a dental mouthpiece. So again, if your spouse, friend, or child snores like a lion, take video, talk to them, have them evaluated so you can improve their breathing, improve their health, and then have them sleep like a lamb. Thanks for tuning in.